Texas-based cosmetic surgeon, Dr. Nikko, joining us, and he's agreed to answer a question that we've had posted online regarding the difference between cosmetic surgery and plastic surgery.
Hi, everybody. Yes, this issue definitely is a confusing issue for a lot of consumers. Every patient want to look for the best surgeon that fits their need, and most importantly, they want to find one that's qualified, that will give them surgery that will not only give them good outcome, but provide surgery in a safe environment and give them surgery in a way that will give the best safety and outcome. So with that said, a lot of patients, when they are searching online, they will run across the term plastic surgery, or sometimes cosmetic surgery, sometimes aesthetic surgery, okay? So they get confused, and then there are many times when they hear advertisement that will warn them to only seek surgery from a plastic surgeon. So exactly what are the differences between a plastic surgeon and a cosmetic surgeon? Well, it is in terms of the pathway or the education that that doctor received during the education that he or she received after medical school. So, for example, after medical school, a plastic surgeon would enroll in a residency program where they will do typically 4 or 5 years of general surgery. For example, appendicitis, gallbladder, those type of general surgery. And then they would enroll in a program that would deal with plastic surgery for another 3 years. Now, during that plastic surgery training, they will typically be trained in all types of things related to plastic surgery, which includes birth defects, trauma, burns, and a little bit of cosmetic surgery, okay? So a little bit of their education deals with little cosmetic surgery like liposuction. They get introduced to tummy tuck, liposuction, maybe breast implant, rhinoplasty. So there are a lot of different cosmetic surgery procedures that they get very little exposed to, but they do get some, okay? But the majority of time is still, they deal with burn, birth defects, and trauma. After a plastic surgeon graduates from that plastic surgery residency, they can obtain additional training doing purely cosmetic surgery if that's what they like, or they can just go on and pursue more additional surgery related to, for example, dealing with breast patients, breast reconstruction, not so much cosmetic, but more reconstructions after breast cancer. So as you can see, a plastic surgeon, there's a wide variety, and a lot of it is reconstruction and doing that type of procedure, and some of it is cosmetic. Well, where does a cosmetic surgeon come from? Well, a cosmetic surgeon comes from other fields that are not plastic surgery. For example, I originally trained in internal medicine, and then I specialized in dermatology, where I started doing a lot of skin cancer surgery on the head and neck. And then I started doing a lot of reconstructions of the head and neck area during my training. And during that training, I find that I really love to do things related more to cosmetic surgery. For example, I was interested more with doing breast surgery. I was interested in liposuction. I was interested in blepharoplasty or eyelid surgery, tummy tuck. So obviously, I'm not going to get that kind of training during my dermatology training. So I have to do additional fellowship training in cosmetic surgery. And after that fellowship, then when I'm exposed to all of those, then I can come out of my practice and start to do those type of procedures. Well, there are general surgeons who follow that path, where they do general surgery residency and they come out and they get further training in cosmetic surgery. There are ophthalmologists who basically come out and do ophthalmology, and then they want to do, for example, focus on oculoplastic surgery. So they have to do additional training to become an oculoplastic surgeon. and they call themselves also a cosmetic surgeon. There are ENT surgeons who want to focus on cosmetic surgery of the head and neck. So they do fellowship in facial plastic surgery. And so in the Academy of Cosmetic Surgery, there's all types of surgeons. There's plastic surgeons, there are dermatologists, there's general surgeons, there's ophthalmologists. So all those people focus their surgery, like I do, on aesthetic surgery. So you have this field where there's cosmetic surgery, and everyone likes to do it because it's a fun field and it's very enjoyable and it's challenging. So there's a little turf battle going on, and so the plastic surgeons feel that, well, we should only do cosmetic surgery. Well, you know, the truth is they have only a little training. They, like everybody else, have to get additional training to do more aesthetic surgery. So just because you're board certified as a plastic surgeon or you're board certified as a cosmetic surgeon, it doesn't really matter so much as how experienced you are and what additional training you've had after your residency. Because when you come out of residency, that's where the learning really begins. For example, when I got out, I did a 1.5-year fellowship, and I traveled abroad, visited many places, outside of the U.S., visit people who are world-renowned in liposuction, world-renowned in eyelid surgery, rhinoplasty, and I visit people who do different techniques in tummy tuck and liposuction. And so I decided that I really enjoy it, and I'm pretty good at it, and so I started doing that and became very good at it. And so breast augmentation, breast lift, tummy tuck, liposuction, body augmentation are some of those things that have really become popular for my practice. And so I practice that in many cases. So plastic surgeons, cosmetic surgeons, we're all not built the same. So when you choose a cosmetic surgeon or a plastic surgeon, it really depends on what they do most, what they're really good at. No one is good at everything. Trust me on that. For example, I can tell you 85% of my work, we are focused on the body. I do a lot of breast procedure. I do a lot of tummy tuck, lipo, body augmentation. 15% of the time, I do facelift and rhinoplasty. When I get a complicated rhinoplasty cases, certainly I will refer to my colleagues, a plastic surgeon or a cosmetic surgeon that's all they do. They do a lot of head and neck, or they specialize in the nose, for example. So I find out what, you have to, as a patient, a consumer, you have to go to each surgeon and find out what he or she are good at. And the easy way to do that is to look at their portfolio. That's the simplest way. You look at all the before and after, how many cases, you ask how many cases have you done, how many cases do you do a week, a month, how many cases have you done total? And it will tell you what their strong points are. And you can know right away that, this person does either liposuction a lot, or they don't, and they focus more on the head and neck. So, plastic surgeon, cosmetic surgeon, again, not all built the same. Cosmetic surgery, plastic surgery, are they the same? Plastic surgery really refers to a field that encompasses some aesthetic surgery or cosmetic surgery, but it certainly includes birth defects, trauma, a lot of those kind of things that I don't do, breast reconstruction that I don't do, because that's more like encompassing with plastic surgery. So I certainly don't handle any of that. I, as a cosmetic surgeon, focus on more aesthetic. So I hope that answers a little bit, help you a little bit. At the end of the day, what it boils down to is looking at the experience of your surgeon, what he and she does the most, and you look at the before and after, you talk to their patients, and you really know what they're good at. And that's really the best way to start.
Well, thank you so much, Dr. Nikko, for so thoroughly responding to that question. I'm sure it alleviates a lot of the concerns that many people may have had regarding that.
Yeah, my pleasure. If you have any questions, give us a call, and we can certainly go into it more. It is a confusing topic, but we love to help you answer it. And you can always call us at 713-960-1311.